and then I'm going to share the screen. Okay, so here we go. Okay, so to start, I'm going to give you some information on how to find pulse. Okay, so we're going to fly through this, and I should get through all 3 pages, despite the fact that we're starting a little bit late. And so here we go. Right? Any questions? Just let me know. You can just I can't see you right now. Right? So just talk. Right? And interrupt me. It's no big deal. Okay, so the pulse, right? So you're going to go right side. We're talking about left hand, right wrist. Okay, so the pulse location. Give me one sec here. Okay, so the pulse location, the radial pulse, okay, is found on the thumb side or lateral, which is also considered the outer side of the wrist. Okay, so at the radial pulse, the radial artery is found on the thumb side or lateral, which is also considered outer side of the wrist. Just lateral toward the outside of the wrist. Okay, so, or sorry, of the flexor tendons of the wrist. Flexor tendons of the wrist. Okay, so these are the flexor tendons. I have a video I'll show you in a little bit. So those are the flexor tendons. So they're just lateral to the outside of the wrist, of those flexor tendons of the wrist. So if you make a fist, you should see the tendons pop out. I'll explain that in a little bit here. The pulse location is found with digits 2 and digit number 3. Okay, so digit 2 is commonly called the index finger. And digit 3 is commonly called the middle finger. So if you don't have these notes in front of you and you have to write them down on a separate sheet of paper, what I would do is I would just, because you're not going to be able to write, you may be able to, but most of you may not be able to write as fast all the sentences. So just strategize how you would write the notes down to help you remember, so that when you go back to the recording potentially and you're able to print, or I'm able to get you what you need, or you're able to edit the document online, you actually have the information to do that. Okay, so the importance of being able to identify where to locate the radial pulse. Is important for 2 reasons. Number 1, to determine whether heart rate is present in an emergency. And to determine heart rate when exercising. Okay, so to determine whether heart rate is present in an emergency, and then to determine heart rate when exercising. So those are 2 reasons why we'd want to find pulse. Now, some people say, oh, let's do carotid. put your finger on your neck and check the pulse with the carotid artery. Usually we don't advise to check the pulse on the neck or the carotid artery, because sometimes you can press too hard on that carotid artery, and that artery actually is the artery that supplies blood to the brain, and it can make you feel lightheaded. Time to time, it could technically make you close to passing out. So we don't want that. So usually we say don't take the pulse on the carotid artery or the neck. It's usually taken on the radial artery. Okay, so emergency types, right? So we'll talk about a couple. We said number one, determine whether heart rate is present in an emergency. So here's some emergency types that you would want to be able to take radial pulse on yourself or on a family member or a friend, or this is potentially in a sports medicine situation, but most of the time we take pulse very rarely sports medicine wise. But so number one, a severe bleed. Okay, so any severe bleed, if there's a severe bleed, you want to be able to take pulse to see where that pulse is at, whether it's in range or not. And eventually we'll talk about what that normal ranges are. Okay, heart attacks. Strokes. And this is just a few, right? There's quite a few more. We're just giving the main ones. Severe accidents with internal injuries. That cause shock. Okay, so
could you move the screen down just a little bit?
What's that?
Could you move the screen down just a little bit? So you can't see the bottom part.
Yeah.
All right, thank you.
There, you want like that? Is that good?
Yeah, that's good. Thank you.
You're welcome. So severe accidents with internal that cause shock. Right, we'll talk about shock later on. There's a lot of different types of shock, but that's just one where we'd want to be able to take pulse. Shock can lead to incoherence, fumbling upon their words, slurring the words, not looking okay, not responding correctly. So we'd want to be able to take a pulse during any type of shock-like situation. So those are just a few. There's quite a few more, but I could list off 20 of them. It wouldn't really make much difference. So I just want you to know that there's a few we'd want to be able to know for sure. Okay, so severe bleeds, heart attacks, strokes, severe accidents with internal injuries that cause shock. Okay, so determining heart rate during exercise is important for the following reasons. So we say exercise and emergency types, right? So here's a few reasons why we'd want to take pulse during exercise. So number one, to ensure you or your client does not pass out or get sick due to overexertion. Overexertion's already is already written on there. So due to overexertion, right? So then we say, well, what is overexertion? Okay, so here's the definition, medical definition of overexertion. Physical exertion to a state of abnormal exhaustion. Okay, so physical exertion, let me just write it down here actually. To a state of abnormal exhaustion. Okay, so there's basically your definition of overexertion. Okay, so there's probably a lot of you in the past, right? Athletes, whatever, that you go out, you haven't been training, the coaches haven't prepared you properly, and they expect you to run like, multiple sprints in the heat, and they'll tell you, they'll basically tell you, yell at you for not doing what you're supposed to be doing, to suck it up, and you're over there, heaving over a trash can because you're exhausted. Basically, they haven't prepared you properly, right? They haven't tested you correctly. They haven't taken your pulse. They haven't done a lot of things, the coaches, to properly determine and assess which one of you are fit and which one of you aren't. And if those who are super fit, they probably could handle those types of runs. Those who aren't fit and maybe haven't been doing the training to prepare for the season need to actually run at a slower pace, right? So you might have five athletes that are okay with running at the pace that they want. And then you have 5 athletes, 10, 15, depending on the sport, that cannot run at that pace. So they need to actually be paced at a slower pace in order to allow the fitness training to be effective and not get them winded and sick within the first few minutes of the exercise, where now the whole session of training is basically trashed because the coach could not properly assess the athletes, and it's all done with taking pulse, right? So it's taking pulse is really important to be able to know whether you are ready for that pace of running. Number 2 is, let me go back to my notes here. To ensure the training regimen improves fitness levels. What I'd also like you to do, looks like most everyone's on Remind now, okay? So the best thing for you is if you get caught out of the class, you get logged off or whatever, send me a message through Remind, okay? Because I won't see the message. I won't see that if we're on Zoom and I'm sharing a screen, I will not see that that you're off and you can't get back in, because I'm only seeing the screen right now that I'm typing on. So just send me a message to Remind, say, hey, I'm out. Can you let me back in? Done. And then I'll look on my phone and make sure that I plug you back in. Okay, so to ensure the training regimen improves fitness levels. We'll talk about that a little bit later on how that's going to work. You'll do a lab to take your own heart rate pulse. Okay, so 3, to ensure you or your client have rested efficiently after one run, for example, to be able to put out maximal effort on the next run while preventing overexertion. So basically what that means is we need to be able to take pulse. So for example, we take pulse, you do a run, right? You take 1 lap around the track. Let's say your pulse is 140 beats per minute. And that's high for you. So we need to basically take your pulse again multiple times while you're resting to make sure the pulse comes down to a certain level before you can go and do your next run. Because if you do a run and it's 140, you do another run right away, it's 140, you do another run right away, you don't rest, it's 160, and you're trying to do 10 runs in that fitness training day, you won't get to the 10 runs, right? If you're not resting effectively between runs, you won't get to the 10 runs. You get to 5 and then you'll be done. 6, you'll be done. Maybe you get overexerted, maybe you feel nauseous, maybe, a lot of different symptoms you'll have of overexertion. So you need to be able to rest effectively, and the only way to know whether we're resting effectively is by taking pulse. Now, not everyone has heart rate monitors, not everyone has access to be able to take pulse effectively. So the best way to do it is to take pulse with your own wrist. And you can start to do this, right? You can start to do this, now, right? Once you learn to take pulse, you do your exercise, you take pulse, you know where you're at. So are there any questions so far about this? Anybody still typing or writing?
I'm still writing.
Okay, I'll give you another 30 seconds. And then if anybody's still writing, I'll come back to it at the end and get you caught up. Okay, so now, here's what you have. Okay, some of you, so those who have it printed out, it's not colored, right? It's black and white. So what I've done is I've colored this for you. What I would like you to do on your printed out sheet, if you have it printed it out and you have just a regular sheet, then what you're gonna need to do is just quickly, I would say, draw this outline of the hand, right, and the arm, and then draw 4 arteries, 1, 2, 3, and then the 4th. If you have the printout, what you're gonna do is you're gonna get some highlighters or some other different color pens or whatever it might be, and then highlight. It doesn't have to be this color, right? I just made it this color so you could see it. Highlight the arteries here. Then what you're gonna do, okay, is you're going to label this exactly like the top picture. So it would look like this. We go deep palmar arch. 3 would be brachial artery. Whoops, sorry. 2 is not deep palmar arch, my fault. 2 is radial artery. 1 is deep palmar arch. Just basically looking at here and you're copying it down. And then this is ulnar artery. And then what you're gonna do is you're gonna color this in. You can color it in the same as the top. You can color it in differently. It all depends on what you want to do. So I'm going to draw freehand. I'm going to make it. I'm just going to do the same thing, same color. So I'm going to color it in so you can see it better. Okay, now you have some labeled and colored arteries from the pictures that you have. So this is the radial artery. So this is the, you're also going to write here on the side, anterior equals front. And then this is the right hand and arm. Okay, so it's basically the front of the right hand and the arm. So you can just, write that there on the left side. And so that way you know that it's not the left It's not the left hand. It's not the back of the left hand. It's the front of the right arm. It's kind of hard to see that on the picture. So I'll give you a couple minutes to complete that. And then we'll move on to the bottom. This for those who are like, whoa, he's going way too fast. I can't write stuff. Like, just again, it's okay, right? I don't want you to feel overwhelmed by it. You're going to take the video link. I'll send the video link on Zoom by the end of the day. And then you can use that recording to go back through it. But for now, right, if we were in class right now, it would be us doing this together. I'd do it no different, exact same way. I'd give it to you. I'd write it up on the board. I'd give you pages, whatever it might be. I'd share a screen with you like I'm sharing here. And you just complete the notes. These are I provide you the notes. We fill them in together. These are the notes that you would be responsible for memorizing the material and studying off of on the quiz. Okay, so that's basically, I provide you with all the content, right? And we create it together. Okay, so I'm gonna move on. If we have to come back, we will, okay, later on. So you have another sheet here, right? Image A, okay, and image B. Image A and image B. Image A is labeled for you. I basically created this document. This is why the Google Doc, I couldn't share this with you. So for those who I sent Google Docs, you don't have this, okay? Because I created this I cut and pasted some information on the sheet and created it by hand. So image A is here. And so basically you're gonna have A, B, C, D, all right? So what I asked initially was image B for you to copy this down. Just for the purpose of the class, I'll tell you what, you can copy. So let's do this. Just label image A and color it. Very similar to what we did before, but there's another artery on image A that wasn't on the images on the top. Image B, I was going to have you draw and color, but for the purpose of the time, I'd like to move forward on this. We're just going to do the same thing. So you're going to, it's a little bit redundant, but redundancy can be good sometimes with learning, right? So you're going to, so this is A. So basically what I want you to do from the top here, I want you to identify the arteries here, right? So what is A? What is B? What is C? And then D I'm going to give you. Okay, so D is the axillary. D is axillary artery. Okay, so what would A, this is again, right front, okay, anterior front. So I'm not going to give you A, B, C. What you can do here, we can also, as you're filling it in, we'll color it in again. We'll make this, I don't know, we'll make it blue. We'll make B black. Again, we'll make C. We'll do red. And then we'll make D green. Okay, so let me ask. Let me just throw it out there. Does anybody want to give me A? What A is?
I think it's the radial artery.
Yeah, good. Who was that?
Cedric.
Cedric. Good, Cedric. So good. So yeah, so radial artery, this is the right side, right? This is the right front of the arm and hand. Good. How about B? Anybody want to throw out B?
Isn't it the ulnar artery?
Yeah. Who is that?
Sarah?
Who is it?
Sarah McQuilkin?
Sarah. Yes. Good. Ulnar. Good. And C.
Brachial artery.
Yeah. Brachial. And then who is that?
Dylan.
Dylan. Good job. Polanco or Hurt?
Blanco.
Okay. Good. Yeah. Good. So radial, ulnar, brachial, and axillary. So there's your A, B, C, and D. Okay. So you should from this become pretty comfortable. Really, I want you to just know the radial artery because that's the artery we're going to be taking pulse on. If you want to do image B, I'll tell you what, if you want to do image B and draw it and label it just like image A, and all you have to do is draw and label A, B, C, D. You don't have to draw all these. I'll give you extra credit. Okay, so if you want to do that and submit it in with your documents when I put it on Google Classroom to submit the documents, if you want to write image B here, I'll give you extra credit for that. I'll give you like I'll give you a point, right? 1 point extra credit. So it's actually going to be, this sheet would be worth, it's only worth 1 point. So you'd basically double up on your points for this sheet. Okay,
What do we have
so
to do?
just draw. So replicate image A where right here where it says image B. So just redraw this and label it, color it, and put A, B, C, D on this side. Okay, just to help you draw, help you remember it.
What if we printed the sheet? Does that, it doesn't count anymore?
What was that?
If we printed the sheet,
Yeah, what do you mean if you printed it?
like, can we still like draw?
Yeah, so you can draw image. So if you had to draw on the sheet, right? You've already drawn image A. Do it again, right? If you had to write on your own notes, so you in order to get the extra credit, just duplicate what you did already on image A. If you printed the sheet, then all you have to do is draw and label one. Cool?
Okay, thank you.
Okay, good question. All right, I'm gonna move on. Now let's go to YouTube. All right, and then Google Sites that help you locate your pulse. So let me go to YouTube, create a video for you. Hello, my name is Dr. Kevin Mercado. This video is to demonstrate how to take pulse on the radial artery. For the purposes of this demonstration, we're going to use the left hand to take pulse on the right wrist. There are two easy ways to locate the radial artery. The first method is to make a fist. You'll see the tendons pop. The radial artery location will be just lateral on the thumb side to where those tendons pop. In order to find the pulse, you'll need to release your hand, place your two digits, digits 2 and digits 3, on that location, press slightly, the location and the pulse will be found. The second way, if the tendons don't pop, is to draw a line either with a pen or an imaginary line from the tip of the first digit, draw a straight line all the way down, past the palm, 2 fingers width below the palm, and the location of the radial artery will be found at that location. That concludes my video demonstration on how to take pulse with the radial artery. Okay, so I just realized I made a slight mistake on the video, and I said that this digit here was the first digit. I don't want to confuse. This is digit number 2, okay? So this is not the first digit. The thumb is actually digit 1, first digit. Then this is digit 2. So that was a slight mistake I just noticed on the video. Okay, so let me go to Google Sites, and I'll show you what I created for you for taking pulse. Okay, so taking pulse, did that video come out? If the video came out unclear, just text in the chat and I'll read it after we get done, okay? Or you couldn't hear it. Taking pulse. Okay, so from the video, I demonstrated taking pulse 2 digits. So here's on the radial lateral side. So here's step 1. So this is what you're going to do right now on your own. Okay, step 1, to find your pulse mentally, or you can physically draw it. Mentally draw a straight line from the tip of your index finger to approximately 2 fingers width from the end of the palm of your hand. So you may also draw a dashed line as pictured below to help identify the radial pulse anatomical landmark. So what I did is I drew the dashed line for you to see. Tip of the digit all the way to the 2 fingers width radial pulse. I basically put a kind of a bullet point there because that's where the straight line stops. The dashed line is designed to help you locate the radial pulse location. The beginning of the line is on the top of the index finger indicated by the black dot. The finish point of the line is indicated by the black dot on the wrist. So to assist you in finding the location of your dashed line should end 2 fingers width starting from the end of the palm. Okay, so this is something you can do now, and we have a little bit of time. You can draw the dashed line from the tip of your finger to this location, or at least just visually understand that's where it's at. So do it now. Take your 2 fingers, go put them basically right at the base of your palm on the lateral side of the thumb, and that should be where your pulse is going to be found, okay? Let's move on. Your radial artery is located just underneath the skin at approximately the point of reference indicated by the pointed finger. So step 2, now make a fist to locate the artery. So make a fist, right? The artery is just lateral to the flexor tendon of the wrist. So it's going to be just lateral here. Again, lateral is always going to be on the thumb side. Medial will always be on the pinky side of the wrist. Okay, medial, pinky, lateral, thumb. More to come regarding medial and lateral later in the semester. Now, as I did in the video, now release your fist. The pulse location will be 2 fingers width below the end point of your palm of your hand. Your index finger should correlate, which is this finger here, should correlate with the black dot, which you have physically or visually drawn on yourself. Once you locate the correct spot, indicated below, you're ready for the next step, which is finding the artery to begin to count your pulse. Once you locate the correct spot for where the radial artery lies, just underneath the skin, you will use digits 2 and 3 to take your pulse rate. So 2 and 3, which I've written on my own digits to take your pulse. And then what I've done is I've numbered my own digits, took a picture of it to inform you and let you see a visual on exactly how they're counted, right? So digits number 1 are numbered 1 through 5, with the thumb being digit number 1 and the pinky being digit number 5. So we'll use digits 2 and 3 to establish pulse rate. Step 4, take digit number 2 and locate your pulse point. Should have a good idea where it's at now. Now, step 5, take pulse using 2 digits. Take pulse using digits 2 and 3 and count for 15 seconds. So first I want you to just find it, right? So find your pulse, and then I'm going to stop sharing. We'll now go into the next phase of this unit, which is your lab for the first semester. So tomorrow, or when we come back next week, what I'm going to do is we're going to go through. Let me get back to so when we come back next week, we're going to go through this lab, all right? So we'll do the lab together. It'll be worksheet classwork number 2. Okay, so what I'd like you to do right now is I'd like you to just show me, like, I want to see your screens, okay? If you can, show me that you know where the pulse is at. So just, I'll go through it. So just share your screens, put your hand up, show me that, and just what we just did, put your 2 digits on the area where the pulse should be and show me your palm, okay? Show me your palm. Okay, good. Got it, Ryan. Good. Polanco, good. Sarah McQuilkin, go other side. Keep Sarah McQuilkin, come to your thumb side more. Okay, that's better. Good. Angel, good. Damien, good. Marcos, good. Ann, good. Abel, perfect. Lilani, good. Is that Lexi? Hey, Lexi. Lexi, go towards your thumb a little bit more. Yeah, good. Perfect. What was it again? Michael, right? Michael, good. Dylan Hurt, good. Nick, good. Dylan, yeah, good job, Hurt. Samantha, good. Ava, Sheckman, go to your thumb a little bit more. Other way. Okay, good. Sarah, good. Sandra, go to your thumb a little bit more. Other way. Keep going. Good, right there. Isabella, I can't see your wrist. Batista, can you go up a little higher? She's, okay, better, good. Archibald, can I see? Perfect, awesome. Samantha, Cedric, good. Samantha, can I see you real quick? Awesome. Did I miss anybody? Carol, I didn't get you yet, huh? Other side, thumb side. Keep going toward the thumb even more. I know that's better. Okay, so did I get you, Cedric? I got you, right? Okay.
Yeah, you got me.
Okay, so we're going to get comfortable with taking pulse on the wrist. So practice it over the next few days, all right? I think what's today, Thursday? I don't see you again till Tuesday, right? So practice for the next, get comfortable with it. Did I get you, Ann? I got you, right? Okay. Get comfortable with it because we're going to get really comfortable with doing the lab. So here's how it's going to work. I know I have 30 seconds. I'm going to send you the assignment. It's going to come up C1 on the assignment to turn in your assignment, which is the sheets that we just did. The first sheet and then the second sheet, which isn't the lab, but it's the second sheet, which is the drawings. So I'm going to give you I'll have it like 11:59 p.m. will be tonight. That's what we'll do for now. I'll make it due 11:59 p.m. tonight. You'll submit the assignment by that time for credit. Okay? Any questions? If you have any questions, I'll stay online for the next few minutes and we can talk. Okay, we'll see you in a few days. Thanks for attending. We'll see you. Have a good weekend. Bye.
Bye.
All right, have a nice rest of your day, Mr. Mercado.
You too, Cedric. Thanks, buddy. Appreciate it.